evening, everyone. A very warm welcome to our esteemed speakers and to all our viewers who have spared their valuable time to be here with us for today's discussion. I am Dr. Nalini Kaushik, and I shall be moderating today's discussion on the topic of the role of India's first indigenous vaccine in making the nation rapid against cervical cancer. Now ranked as the second most common cancer in women worldwide, India accounts for almost a fifth of the global burden of cervical cancer, with approximately 1.2 lakh cases as incidents counted annually, and around 67,000 deaths per year. If detected early and managed effectively, cervical cancer is, however, preventable. In India, vaccination against cervical cancer is being used clinically since almost more than a decade now. However, the uptake of the same has seen its fair share of hurdles. Now, nevertheless, the importance of HPV vaccination cannot be undermined. And now when India is about to launch its first locally created affordable vaccine for the prevention of cervical cancer, the hopes are high that the fight against the rising number of cervical cancer cases could be a success. Now, to help us reflect upon the same, today we have an esteemed panel of speakers who are the most very renowned faces who have contributed immensely in the field of cancer care and public health in India. So we have with us Dr. Bhavna Sirori, who is the Medical Director of Balco Medical Center, Naya Raipur, Dr. Ravi Mehrotra, who is the founder of CHIP Foundation, Ms. Urvashi Prasad, Director, Development Monitoring and Evaluation Office, Niti Aayog, and last but absolutely not the least, we have Mr. Raj Shankar Ghosh, Senior Advisor of Vaccine Delivery at India Country Office of Bill and Melinda Gates Foundation. Thank you so much to all of you for being here with us today. It means a lot for the common cause that all of us are working towards. And without now losing, more time, I think it'll be great if we can set the context for today's discussion. And Dr. Bhavna, if we can just start with you that, before we go into the, intricacies of affordability, accessibility, which are the larger questions and implementation, larger questions that are looming in front of us, if we can just take some time to understand the burden of cervical cancer and, the existing scenario of cervical cancer and related vaccination in India. Over to you, ma'am.
So thank you so much, Dr. Nalini. And thank you for doing this, because I think the more we talk about it, the more we create awareness as well. So cervical cancer and breast cancer are the two commonest cancers in women in India. And cervical cancer is more common in rural India. And we know that the incidence, that is new patients being diagnosed with cervical cancer, is actually decreasing. So, infection-related cancers. So cervical cancer is related to this human papilloma virus infection.
Right.
And there are vaccines against 2 strains, 4 strains, and 9 strains. And we know that they prevent about 80 to 90% of cervical cancers.
Right.
So in villages, the incidence is about 1 in 7, 1 in 10. In urban India, it's the incidence of breast cancer, which is high. Yep. And according to the last statistics, the new cervical cancer patients that are being diagnosed in India are almost up to 1 lakh. And there is a lot of underreporting as well.
Right.
So I think even though the numbers are going down because of the sheer population that we have, the numbers are quite significant.
Correct.
And to have the vaccine available, which may prevent this cancer, is absolutely amazing. And along with the vaccine, one more point I'd like to make is that cervical cancer screening should continue despite the vaccination.
Absolutely. Absolutely. Thank you so much, ma'am, for helping us understand, giving us the numbers, because I think it's always good to start with numbers and knowing, what is the real situations. And even if, there is a rural-urban divide here and, the cases are going down, I think, like you said, screening is paramount. Even if immunization programs, are important from the preventive perspective. Now, of course, we'll go into the intricacies of how the screening programs and, all of the other programs, aspects of, such programs are, being implemented in India. I think if we can just again contextualize and understand that, HPV vaccination is of public health importance, and the new soon to be launched, vaccine is of, it has, it is going to remarkably bring down the cost development in the Indian public health scenario. And if we go back to what the entire debate about this particular vaccination was in India, was cost was central to that kind of a debate. So, what are your views on this particular development that is currently going to be happening in India? And do you think this particular development is going to be, or it can be correlated to the behavioral shift of mass immunization and the kind of thing that we have been waiting for, mass immunization?
So I think there has been, in India, first of all, we don't like talking about cancer. So there is decreased awareness as well, and cost has been a huge issue. So
Right.
I have spent almost 2 decades in a country with universal health coverage, UK. And all the kids get vaccinated in schools, and they get vaccinated against HPV as well. All the girls. So I think in the earlier stages, all the girls were vaccinated in schools of appropriate age. But after that, they were vaccinating the boys as well, not just the girls.
Yeah.
Because we know that the HPV causes not only cervical cancer, but a lot of other cancers as well, like anal cancer, oral cancer. So by giving that vaccination, they were able to prevent those other cancers as well. So this is a national immunization program in most Western countries.
Yeah.
And Indian Academy of Pediatrics does endorse the HPV vaccine for girls. But
Right.
despite that, there has been hesitation by the government to take the money. And I think there are threefold reasons for that. One is, of course, money. Money is very, very important. Second is the political will. Because, when you give a measles vaccine or any other infection-related vaccine, you see the results immediately.
Correct.
But in a cancer vaccine, you will see the results maybe a decade later.
Yeah.
Patients have to be followed up by almost a decade or 2 decades,
Yeah.
and by then the governments have changed. And the third is, capacity. So these are the main reasons why there has been a hesitancy in uptake, even though the national societies have recommended it. So bringing the cost down, I think, will be a huge win-win situation for escalating the vaccine and hopefully implementing it as well for our country.
Absolutely. Thank you so much, ma'am, for pointing that out. Since I think we have Ms. Urvashi Prasad and Mr. Raj Shankar with us, I think, because what you said has a very clear correlation and implication on the policies that we have and the implementation of the same. So, Ms. Urvashi, if we can just begin with you that it is a growing burden in the country. We are in the second demographic dividend where it is community immunization, school awareness, and school like educating children in schools, etc., becomes really important. And it till the time there is no policy shift around it, it's again the success rate of what these developments need to see may not percolate down. So what do you think, like where we stand in our country? How do you see as part of in where you stand in terms of a representative of the government? How do we understand cervical cancer, the burden, and taking the entire shift towards more policy developments? How do you see that?
Yeah, I think firstly, I'm just confirming, am I audible?
Yes, absolutely. Please go ahead.
Okay. So, so I think, this is firstly, I would say from science and innovation perspective, I think this is a very big step for us forward. That we've been able to now develop our own indigenous vaccine, and we've been able to bring down the cost. Because cost, even when you look at it from the government's point of view, implementing any program, cost is always a very big factor. And especially in public health, when you have an instrument which is cost effective, then it makes it that much more palatable, to the policymakers and to the politicians. I'll give a very different example, but it can be used, when we look at deworming. Deworming is a very cost-effective intervention, so it's often much easier to convince a policymaker that why should we go in for mass deworming. So I think this is of course vaccination, and it's different, but I'm just trying to give a parallel example. So I think cost is a very big factor, but also from the government's point of view, from the supply side point of view, we also have to build capacity. How do you administer this vaccine? Where do you administer it? How do you integrate it into your national programs? We already have national health programs for adolescents. So how do you integrate this vaccine into that? And also, how do you train health workers? How do you build their capacity? Because with any new vaccine, what happens is that suppose somebody takes the vaccine, they experience some side effects, there can very quickly be some misinformation which gets spread. And very quickly people can dismiss the vaccine. And we saw that with the COVID vaccine as well, where there's a lot of hesitancy. When we look at cervical cancer, there's also a lot of stigma. There's a lot of social stigma when we look at a cancer vaccine. So suppose somebody experiences some side effect very quickly, it can sort of, become a situation where people start refusing the vaccine. So it's very important that the capacity of health workers is built so that they can actually explain everything to people. What is the vaccine all about? Why is it important? Why is it given? Etc. So I think from the supply side, building that capacity is also a very, very critical factor beyond the cost. And then from the demand side, I would say creating awareness amongst people, addressing the stigma aspect, making sure people understand, how the vaccine works, the fact that, it's not a vaccine which will cure you or prevent something today, but it will prevent, your illness in the longer term. And therefore, while it might not be very tangible to you today, it is something crucial that you must invest in for your health. So I think this education of people, the government needs to do along with civil society, along with the private sector, and make sure people are really aware. So I think there are both supply and demand side interventions that need to take place from the policy side.
Absolutely. Thank you so much for pointing that out. And Mr. Raj, we will, after what we've heard from Ms. Urvashi, because she's talked about integration with policies, she's talked about capacity building, she's talked about implementation and various demand and supply factors here. All of it is, you have a decades, of experience when it comes to implementation, rolling out various vaccination programs in India. And it is easier said than done because there are plethora of, hurdles. There are multiple stakeholder groups on all sides, be it demand side, be it, supply side, and be it the community at large. So first, a generic question of when it is about, rolling out a vaccination program, which is like this, which is in a way sort of an adult vaccination program. What has been the kind of experience in the Indian context? Leaving aside what we are talking about right now, because then we, after hearing that, we can integrate about cervical vaccination.
Yeah, first of all, I'm audible, I believe.
Absolutely, absolutely. Please go ahead.
So before I begin, I just wanted to reiterate two things. One, what Bhavna and you said about the importance of screening. Vaccination alone will not serve the purpose. We will have to have early screening of cervical cancer. And the second is what Urvashi spoke about in terms of, ensuring that we are able to educate the mass for the demand generation. Now, generally for any vaccination program, what we call is, it is a SAD affair. SAD meaning supply, access, and demand. Now, in terms of supply for HPV vaccine, for many years, we have struggled. And I believe we just now heard about why India was not able to introduce the vaccine because of issues around the price, because of political demand, and all of that. Just give me a second. I'm sorry for that. So basically, we need to ensure that there is an uninterrupted supply of the vaccine, which we can now ensure with a domestic manufacturer. Affordability we spoke about. So these two conditions are checked. In terms of the second factor, which is access, we will have to plan the vaccination program very well in terms of how the vaccine is delivered. We have some models. We have some models about thinking of school vaccination. We are thinking of organizing some kinds of campaigns. And India in general has a very large experience of conducting vaccination campaigns. The efficiency part in terms of working on evidence in case of vaccination, India has done that for various campaigns, including polio and measles. So India should be able to do that well. The major factor that comes for HPV vaccination is around the demand. Right. Most of the countries where it has been introduced, people have struggled with the coverage. And that is because of the various issues that are there. And I believe the experts in this roundtable conversation are much better placed than me to speak about it. But it is very important that we educate the community, we make the community aware of the importance of the cervical cancer vaccine, the HPV vaccine, and we need to have a high rate of coverage in order to achieve the impact that we desire to achieve. But I'm very confident that with the kind of experience and expertise that we have in India, in terms of conducting good vaccination campaigns, we will be able to do a good job.
Absolutely. And, there's, in a way, there's sort of a coherence, in what we have heard so far. And one is, of course, we have been talking about the policy and the political will on, at one level. And then immunization is no replacement to a regular screening because they go hand in hand, they go parallel. And all of what we have discussed is, to a very large extent, is dependent upon, a behavioral shift, right? But yeah. Having said all of it, whatever we are discussing today, do you think since, we are going to be launching a vaccine, which is going to be make the vaccine very affordable, do you think can we still do without a top-notch policy, a guiding policy, right? Or a, program, because should there be a standalone or a specific program for cervical vaccine, cervical cancer? And is that going to help, or are we going to be, sporadically, be conducting what we have?
Sporadically, nothing works very well. Everything has to have a good plan, and if a framework needs to be there in terms of how the vaccine needs to be delivered. And as I started this conversation, I had said that vaccines do not work standalone. Okay. How best it works is in an integrated manner with various other strategies. Okay. Sanitation, these are important. In case of these adolescent vaccines, we will have different things to consider. But one other important point that I wanted to make is whether we are successful in conducting a very high coverage or a efficient HPV vaccination program is dependent upon how well we build the partnerships. The private sector will have to play a huge role in this. We will have to partner with new partners. For example, FOGSI, the Federation of Gynecologists and Obstetricians in India, has not been a part of the general UIP program of the ministry. But here they are a very important partner. So therefore, I wanted to reiterate that in case of HPV vaccination, the private sector will have to play a huge role in terms of, convincing the community, in terms of collaborating with the government, in terms of the policy decisions, in terms of the program, planning and the infrastructure that we built to deliver the vaccine. So therefore, there are multiple new considerations. One is that the beneficiaries will be of a different age group than the universal immunization program has generally attended to. The second is that we will have to have new partners, and most importantly, we will have to have a very different delivery mechanism. Here in this case, the school vaccination program will have to be understood better, and we will have to understand how we conduct campaigns in the adolescents. So yes, I completely second what you said, is that it has to be done under an umbrella program of cervical control. There needs to be an integrated policy, and vaccination has to fit into the larger integrated strategy that we have to address cervical cancer.
Absolutely. Thank you so much. So, Ms. Urvashi, I'll just come back to you on the same question because while again, I would reiterate that we are launching a super affordable vaccine in the Indian context, but even when we have that vaccine, if we continue to, do the, or implement it the same way, I think we can just reach so far, right? However, if the same thing is done under a proper policy framework, having different components integrated into it, or, like Dr. Bhavna said, that how it is being done in many other countries, it is integrated into other vaccination programs, right? So do you think, like, we may also even have to take our thinking a little step ahead, even before we launch the vaccine? I think at the level of the government, I think we need to also, start thinking from that perspective. What do you think?
Yeah, I think, it definitely has to be integrated. But I think, we have to look at firstly what are all the existing platforms that we can leverage, to deliver this vaccine. So schools was programs which are supposed to be delivered, including for adolescents. So we have to see how can we integrate this vaccine into the school health programs. The other big platform which I think can be used for this vaccine are the health and wellness centers, because the health so it would be delivered through these health and wellness centers, hospitals, with other healthcare facilities within the government system, but with the private sector as well. Because as we know, much of India's healthcare is in the private sector, and most people actually visit private facilities. So we need to make sure that this vaccine is, also available at a large scale at those private facilities. So I think it definitely, even if we don't have a completely new policy, we certainly need to think very systematically and strategically about how do we integrate this vaccine into what we already have. And then do we need to create any additional, mechanisms that we need to put in place, or any additional platforms, just given the unique nature of the vaccine. So I think both those aspects we need to think about very carefully from the policy perspective. One is, integration into our existing programs and platforms. And the second is, what new do we have to do, whether in terms of using a new channel for the vaccine or using some sort of new capacity building, creation, etc. So I think both those elements we need to think about, and we certainly need to integrate that into our policy before we do a nationwide rollout. And we have to make sure that the state governments are on board. Because with any such rollout, it's not just sitting in Delhi that you can decide the whole plan. You have to work very closely with the state governments, because ultimately the rollout is going to happen at their level. So the different state governments, the differing situation with respect to cervical cancer, the different approaches that they have to screening, all that needs to be factored into any national plan that we develop.
Right, absolutely. Dr. Bhavna, we'll just come to you with the same question. While we have got a very adequate share of response from both the set of stakeholders here, but from a clinician's perspective, right? What do you think? Like, of course, I think we all agree on one fact that without an integrated, thought-through framework, implementing a program like this, may not be, may only take us this far. And when we talk of, mass screening and, reaching the kind of success that we are sort of looking at in this particular space, without an integrated policy or a framework or some similar programs may not, be adequate. So what do you think, first of all, about this particular aspect?
I think we'll face a lot of challenges in implementing, and the biggest challenge we'll have, because I have tried to drive this in villages, in schools, in at least 5 states in India, And it's a huge challenge, mainly because of social, cultural barriers. And so I think a lot of awareness, education needs to be done. And I strongly believe that, we have to use the infrastructure that we currently have. And India runs a fantastic national immunization schedule. We have been able to eradicate polio. So I think I would work, we have to use, of course, everything, but I would work with the national framework that we already have, train the Mitayan, Asha, Anganwadi workers.
Yeah.
The issues with the HPV vaccine, practical issues that we will have, of course, we have that with most vaccines, is of course the cold chain. It's a single vial. I don't know with the Indian one, whether it's multi-dose vial. Single vial, it takes a lot of space. So, transporting it to various places, and also logistics issue, you because where will you get the kids? You will get them in schools. So I think schools have to be involved in this. And 70 to 80% of healthcare is delivered in the corporate or the private sector in India. So I think they have to be on board and involved, and we have to engage with the religious groups. I remember talking to a group in Bangalore, two groups actually, because they run like 400 schools. So, so that is where the kids and the girls would be. So I think we have to try, and FOGSI is a society, Indian Academy of Pediatrics is a society. I work at Balco Medical Center in Raipur. So they have a network of Nandghars and also Swasth Gaon Abhiyan, where I think one can be connected to, I'm visiting some Nandghars in Raipur and Odisha and Jharkhand, I know that. And it's a huge network in 12 states of Nandghars where, where the kids are given school, the women are upskilled and the girls are taught. So I think we have to try and have a strategy to target everything. And the most effective strategy, I think, would be the WHO directive that came out a couple of months ago, is, even one dose is enough. So I think if we are able to, as a government, make a policy that, we will vaccinate every child who is between 9 to 20 years of age. And, so all of these things, if we do and move forward, I think we should be able to do it and engage with the gynecologists, pediatricians, oncologists, physicians. So nobody should be left out.
Thank you so much, ma'am. And in fact, you just pointed out, how it is being, your experience at the community level, because that was my follow-up question to you, is that while we are talking, all, the macro landscape around it, in the last decade, we have seen, a lot of challenges, if I put it this way, when it comes to, HPV vaccination and, because there was a lot of information asymmetry that we have seen at the community level, related to risk, associated risk, and all the negative beliefs, or the kind of traditional thinking that comes into play. So, what do you think? Like, have we been able to at least surpass some of those challenges, and or is that also a very considerable threat or a hurdle for us, as we talk today regarding specifically to this cancer?
So I think, I would treat it as any infection related vaccine, because it is targeted against an infection rather than creating a big thing about it. And the key thing is education, because that itself is the biggest empowerment. And for that, the teachers, the parents, one has to target everybody as part of this education. And there was a bit of negative publicity almost more than a decade ago, I remember, about the vaccine. And the government did a thorough investigation. It was presented in the parliament. I remember speaking to Dr. Neerja Bhatla at AIIMS, who was part of the investigation. And they looked very deeply into all the side effects and all the negative effects that happened with the vaccine. And the vaccine was safe. So, every drug I tell patients has a side effect. Even paracetamol can cause liver failure.
Yes.
You do have what we call these idiosyncratic reactions, but all of us take paracetamol if we have fever or whatever. We don't think that it's going to cause liver failure. So I think one has to look at the risk and benefit. the benefit here to the greater good and the community is so huge that it justifies that very tiny risk.
Absolutely, absolutely. Thank you so much, ma'am. Dr. Ravi, do we have you here with us? I think he's still not here. So we'll just move on to Mr. Raj. So now understanding, the challenges that we have seen, in the past at the community level, at the local level of information asymmetry, specifically when it comes to, such vaccinations. Even during COVID, we saw that, and behavioral change communication programs become really important. So, in your experience, like if you could share some knowledge of how you have seen the vaccination drives rolling out, and have we learned something? Has the needle moved after COVID? That was a massive vaccination drive. So, is that going to be a learning curve for us here?
Absolutely. In terms of, the vaccine hesitancy, I think WHO has already identified as one of the, big public health challenges moving forward. In terms of COVID, we did see a lot of initial hesitancy because of various misinformation being communicated, and also because there was a lot of apprehension about the vaccine in general. In case of HPV vaccine, as Bhavana was saying, that there has been a period in India when there was a lot of conversation on HPV vaccine in terms of its safety, in terms of the return on investment and all of those issues. I think we have passed that stage, and globally and also in India, we understand the value of HPV vaccine in terms of ensuring life and a good quality life to its citizens. But in terms of India's experience with the community mobilization, I think there's a huge experience. We have very clear understanding of what are the reasons for vaccine hesitancy, and that we generally talk about 3 A's: access, awareness, and affordability. There's a 4th A, which is apprehension. So there are these 4 A's which are related to vaccine hesitancy. And therefore, as you understand, it begins with access. So therefore, if we are able to ensure that there is a supply of vaccine, there is a general kind of awareness of the community that can be done through various, information, education, communication methods. I think Urvashi or Bhavana, I don't remember, someone said about involving the religious leaders, the community leaders. Panchayat will play a big role in this in terms of convincing the community. So we'll have to take all of these stakeholders together. And again, we have to reiterate that in case of HPV particularly, we will have to look at the private sector, because they will have the correct message in concurrence with the government program. So therefore, I want to once again say what Bhavana said, that we will have to ensure that vaccines are available in good condition at all the places of delivery, schools or wherever they are being delivered, in proper cold chain. We will have to make the community aware, and we will have to address the issue of apprehension, wherever the issue comes up, and we'll have to have an affordable vaccine.
Yeah. Absolutely. And also, like Ms. Urvashi, Mr. Raj has, I think twice reiterated, the need for private sector's participation in this. And I think that we all understand that sort of, support is really important. So how do you see that in order to scale up, the implementation from, of course, from capacity building perspective, and also, from, implementation perspective, how do you think that such collaborations, where do they stand currently?
Yeah, I think that's what a lot of this planning process will have to build in, is how do you like you said, it should not be something which is sporadic or ad hoc. So we will need to very systematically in the rollout plan look at private sector engagement at different levels, in different states, and at different types of facilities. because you have the primary healthcare facilities which are mostly in the government sector, but a lot of people also go to the private sector. In fact, most of the footfall you see is in the private sector, even if they are at so-called informal private sector facilities. So we'll need to make sure that we involve all sorts of private sector players, because not everybody goes to an organized or a formal private sector establishment. A lot of people go to these informal establishments in the private sector as well. So we need to, at least from the purpose of information dissemination, we need to integrate everybody. Because
Right.
wherever people are anyway going, wherever there is anyway a footfall, we need to make sure that information is available about this medicine. So I think one type of partnership is about creating awareness and disseminating that awareness. But the second part is actually the supply of the vaccine at different types of facilities in the private sector. And I think that's the plan that we need to build up, and it needs to be rolled out at the state level. Like I said, we can all sit here and talk about what needs to happen at the national level, but ultimately we have to make sure that states are an integral part of this plan, because they will best be able to judge what model suits them, and how they want to engage the private sector, and so on. So I think that flexibility must be built into this national plan that we have, so that we can make sure that our solutions are customized depending on the needs of different states.
Absolutely. And I think when it comes to, the diversity of India, anyways, one solution for the entire nation has never, sort of worked in our country. Dr. Bhavna, if I come to you that, okay, immunization is very important from preventive health perspective, and we cannot, underestimate the role it can play. However, I think there's a coherence of one aspect about when it comes to cervical cancer is screening. And if even I was, sort of looking at the data, and if the data was correct, only 10% of women in our country actually, go for early screening for cervical cancer in our country. So I don't know if the data is correct, because I couldn't, verify the source, but I think screening is very important, or screening is actually one of the most challenging area when it comes to any kind of cancer. Because we say that we always think that it's the other person who can get cancer, but not us. So with that sort of mindset, I think it's a very difficult to internalize that kind of thinking. So where do you think we stand in terms of screening, and how can we also parallelly move the needle when it comes to early screening? Because that again as much as immunization is a behavioral shift, and is largely information remains, access to information is central to that kind of part of cancer care. Again, I think it becomes very central to screening as well. Till the time people do not have adequate information, that kind of behavioral shift becomes difficult. So where do you think we stand, and how can we sort of move the needle in that front, on that front as well?
So I think that's a very important question. So cervical cancer is one cancer which is, by screening, we can detect at stage 0. So even before it's become cancer. So what we say is precancerous stage. So I think one can nip it in the bud when it's detected in precancerous stage. And at the same time, when you detect it, one can treat it as well. So it lends itself to it because it's easily accessible. The area is easily accessible. And screening, I think your figure may be right, or my feeling is the figure is going to be lower, because there is a lot of opportunistic screening which happens in the private sector. In the villages, I think unless it's led by a government sector where the Asha, Anganwadi, or even healthcare workers are trained, it is usually not done. And the other great thing about screening is that we in India have led the way in screening methods which are cost effective, like visual examination by acetic acid or the Lugol's iodine. So you don't need a pathologist for a pap smear, or you don't need to do the more expensive test, which is the HPV DNA test. We have 3-4 modalities. One is not so sensitive in picking up the cancer, but overall, if you're going to do a population-based screening, I think for our country, a visual examination by acetic acid or Lugol's iodine would be the way forward. And in a lot of states, quite a few papers have been published where they are trained to take a photograph of the cervix and send it to somebody who is trained, and they're able to say that this could possibly be a precancerous lesion and we need to do something. Sort of 100 people you screen in a day, that one patient could be sent to the main center. And I think this is what the government can do. They can do it at the PCC level and then send them to the CHC. Where so you work with the system. So I feel all of these modalities, of course, HPV DNA is also highly sensitive, and it needs to be done every 5 years. So I think it may turn out to be cost effective. The Pap smear needs to be done every 3 years. So I think the key message that you want to get through is it's not just one time. You should do it at a regular interval every 3 to 5 years, depending on which test you've had. I mean, if every woman in the country even has one screening, I think that also would be a win-win situation for everyone.
Ma'am, somewhere, we are talking about that, everything that needs to be done, and women become like, how do you think, how can we sort of tap in that entire pool of...
So, hello, can you hear me?
Hi. Yeah, I can hear you now. Yes,
So
I think I lost the connection.
So this applies to women not only in India but in the West as well, where they don't prioritize their own health.
Right.
They always prioritize the family's health. Either it's somebody's birthday, or they're going on holiday, or there is here, I mean, it's in monsoon season. So I think these kind of priorities take over. Health does not take a priority. And also for women to be convinced to have a Pap smear, I think Ravi may also talk about it. He's here. He's had a lot of experience with the training as well. It is quite a challenge to convince them. It won't happen in one visit. So you have to be persistent. You have to meet the village elders. You have to convince the elders, and then you have to convince the husbands or the brothers or the fathers. So that is the other issue we have in India, which is very unique, that women look up to the men in the family in most of rural India to get permission to get things done, or to do anything, even for cancer treatment. I mean, they look up to the men in the family, including a son. She's the mother, but she will look at her son to, decide what treatment option she needs to have. So I think as all of us have reiterated, we have to just keep on educating, training, and increasing the awareness to, look after their own health.
Absolutely. I think the relevance of education and training, I think, cannot be, negated any which way. Dr. Ravi, thank you so much for joining us today. And so far, I don't know if you were hearing the conversation finally as well, but sir, you're on mute. I'm so sorry. Can you please?
I'm sorry. Yeah. I had one ear listening.
Wow. Right. Thank you so much, sir, for joining us despite your, tight schedule. But so far, like we have talked about, or we have discussed, the scenario of cervical cancer in India from the incidence perspective, and where do we stand, in terms of infrastructure and at the policy level, etc. We have sort of done a macro dive on the entire subject, but from you, if we can just take a step back, and if you can also help us understand, the situation with cervical cancer in India. And then, the current development of, because finance was the biggest hurdle when it comes to immunization in this particular area. Now, that is, one thing that we would be breaking very soon. So how do you see the needle moving here on?
Well, if you just want a one-word answer, there is no reason why it should not be moving very fast, number one. As has been already discussed, for the last nearly 2 decades, we've been fighting this war having practically a quarter of all the cases and the largest number of cases in one country we still have in India, which is so unfortunate. We have made so many strides in various other spheres of life. So many revolutions have happened, but unfortunately, cancer cervix is a revolution which has not really happened, unfortunately. Cancer cervix is one of the very few cancers where we know the cause. We have a vaccine now, hopefully available at a reasonable cost. We have early diagnosis, and we have reasonably good treatment facilities where available. It's about the only cancer, to be absolutely honest. I shouldn't even say very few. Now, for that, for people to be diagnosed in stage 3 and 4 and die of cervical cancer today in a country like India, where so many, now we are the 5th largest economy, we keep on tom-tomming how great things are, but if we have not done anything worthwhile as far as cervical cancer is concerned, I think we are missing the bus. I will not go into details about what happened in the past in previous demonstration trials in Andhra and Gujarat, and why politics came in the picture, why misinformation, and why, of course, cost was a major issue. But now, if this particular vaccine just got approval from our friends at the Serum Institute, should be between 200 to 400 rupees is what has been quoted. I think the stage is set, and as the numbers increase, the cost will probably go down further. It should be a part of the universal immunization program. As has already been mentioned, it has to be accompanied by cervical screening, which is the government, the health ministry and the ICMR have already rolled it out. Unfortunately, it's still to be, because of the COVID, got a bit of a setback, but hopefully we should see it back on the road. So in a nutshell, I think the road is clear. If things go as per plan, and I hope it does, there's no reason why it should not be on the road now.
Absolutely, absolutely. So also, we have been also, I think very subtly you also in your response enumerated the sort of, the potential challenges, the challenges that we have seen in last one decade when it came to implementation. Very subtly you had put that, but if we learn from that particular experience and what we have, the one of the major hurdle that was in this particular, cancer area is being, resolved now. What do you think would be the potential challenges here on as well? And I'll just circle back this question to the fact that, we had Ms. Urvashi Prasad from Niti Aayog, and we were talking about the fact that while this is a major development, but without, a central framework or a policy framework or a guiding document, it may not be, possible to implement or have an effective implementation when it comes to a program like this.
Dr. Nalini, that's absolutely correct.
Yeah.
As a matter of fact, there is a lesson to be learned as far as the COVID vaccine is concerned. We have to be very sure that cautious optimism. And as a matter of fact, now that we have this app, the CoWIN app, where we have used Covaxin and Covishield, that is really the way to go. Slow and steady. I don't expect the world to change overnight. Take 20 districts at a start, make sure everything is under control, and then expand further rather than trying to get it all over the world, all over the country, because here, unlike COVID, it is not an emergency. And also, as Bhavna and other colleagues have mentioned, you will see the results after 2 or 3 decades, if not more. So it's not an emergency, but it has already been delayed for so long. This is one single step which can actually change the scenario. And the interesting thing is not only cervical cancer, it is various other cancers of the vagina, vulva, or anal cancer, and oral cancer, and in males it is penile cancer. Of course, at the moment we are going to focus on girls because that is obviously far more important, but that is where I see the way things are going to go. Other challenges would be certain amount of vaccine hesitancy, as we did see initially with the COVID vaccine. And that is where the public information system and the government comes in the role. The role of private setup, I think, once the amount of money is less, there will be a certain disagreement as far as the private sector taking it up. But I personally feel as a comprehensive package, if it is approached in the appropriate fashion, there is no reason why this should not be a success.
Absolutely.
And of course, we will face more challenges which we probably haven't even thought about. But if there is a will, there is a way. That's really the bottom line.
Right, absolutely. And so I have, a follow-up question, which many a times also intrigues me at a personal level. And I think this question is for all three of you, that if on a scale, if we compare childhood vaccination to adult vaccination in India, if we look at adult vaccination in many other Western countries, to put it this way, I think the uptake is higher. The knowledge level is very high. But when it comes to India, the scale, it's really imbalanced. Childhood vaccination, for many historical reasons, right? Infant mortality and many other reasons. I think the information, the policies were driven in a certain way that people have adequate knowledge, and therefore the adherence is pretty high. But when it comes to many other, adult vaccination programs for various areas, not just cancer, but for many other areas as well, there are a lot of inhibitions at behavioral level from people, at personal level. We have created that sort of information asymmetry, that the associated risks are really high. So I think the uptake is really low. So do you think, at a certain level, I think that also needs to be sort of, countered? Dr. Ravi, you have to leave, so we'll just start with you.
So no, definitely it has to be counted, and that is where the information level and folks like you with the ISW Council, the mass media, now the social media, I think that is where the role comes in. The fact that it is the safest of nearly among all vaccines, and also the fact that it is a cancer vaccine. It is the only vaccine, to the best of my knowledge, aside from hepatitis B, which is a liver cancer vaccine. It is the only vaccine that is currently available. It has been tested by millions of people. As a matter of fact, our ICMR Institute was one of the places where it was supposed to be tested, but for various reasons we could not get that through. So we had got the DGCI approval. There is all the boxes have been clicked. There is no way we should not be looking at it, and that is where and not only information about in the public, but also information to medical and paramedical people. That is also equally important.
Right.
If the paramedical and medical people are not convinced, obviously they will not be able to convince it further.
Right.
So a comprehensive information package is really what we require.
Absolutely. Thank you, sir. Yeah, I think, So I think we would also be closing this discussion soon. So, ma'am, we have discussed about that, how significant this particular development for the country is, how it is breaking the cost barriers, at least from the supply side. Now, what we need is, we also need to cross the financial barriers when it comes to resource mobilization and for the implementation perspective. So from knowing that, and I think we have also talked about the plethora of challenges that are there in a country like India, which is demographically different, which is socio-economically also there are various factors. Education perspective wise also, there are a lot of different entire spectrum there. So having known all of that, what would be your closing remarks that if we need to be rapid against this particular fight against cervical cancer, and like Dr. Ravi said, that this is one of the only vaccination that is available, so the seriousness and the urgency becomes much more important given for a country like that of India. What would be your closing remarks, and how all of us can collectively come and because we can wait for the government to do whatever the government is doing, but a lot lies at the level of people like us. So what would be your closing remarks on that?
So I think you doing this program is amazing, and we should all take a pledge that we will eradicate cervical cancer. And the only way we can do that is by mass vaccination, and also continuing on with the screening for cervical cancer. And I have vaccinated all the kids in my family. So my daughter, my nieces, my nephews, everyone. So that itself, I think we should try and do with whoever is within our circle, that we talk about it and get them vaccinated, and also do patient advocacy, you know, with the governments wherever we can. We should try and talk about it and encourage people to take it up, talk to NGOs as well. And I'm pretty certain that the government is going to come through at least with the 1-dose vaccination.
Absolutely. Thank you so much, ma'am. Mr. Raj and Dr. Ravi, closing remarks from both of you.
No, I think, you know, I just wanted to reiterate what has been said till now. I really liked what Dr. Ravi said about that, you know, we should move cautiously forward and not just ramp up throughout the country. It needs to be built upon the evidence that we are gathering from the community. And India's universal immunization program has highly relied on evidence. So therefore, evidence is important. The second is, you know, in this process, we need to empower the community. So along with evidence, I would really focus on empowering the community with knowledge, the knowledge that we have been talking about. And it's not only about the community, but also the community of providers of services and private sector, again mentioned. And the third thing that I wanted to mention is that, you know, in COVID, one of the biggest success that we achieved was a very transparent dialogue between the government and the community in terms of sharing of information about coverage, about the hurdles being faced. That culture needs to continue. A transparent communication between the government and the community in terms of how the services are going on, what needs to be done, and what are the hurdles that are being faced. There are wonderful people in the community who can act as facilitators of this vaccine. They must be roped in order to take this program forward.
Absolutely, sir. I think phase implementation and the role of community, I think that can never be underestimated. Dr. Ravi, last closing remarks from you.
I think he's...
Yeah, sorry.
We know you have another meeting to jump to. Just last closing remarks from you. That's it.
Well, all the very best. We have been waiting for this development for the last at least a decade, because this has been in the pipeline. It got delayed because of the COVID infection. So we are very, very excited. I think it's a dream come true if everything goes well, done in a concerted fashion, as well thought out plan. There is no reason why we'll not succeed and make cervical cancer disease of the past.
Thank you so much. And I think with that, we are closing this discussion on a very optimistic note. Thank you so much to all of you for joining us today. And we look forward to, you know, I think collaborating more specifically on this area. And like we had discussed, so that, you know, it's a collective fight against this particular cancer.
Thank you so much. Bye-bye.
Thank you so much.
Bye-bye.
Bye-bye. Thank you.
Bye, sir. Thank you so much.